Hey guys, this is Dr. Jean-Guy. Today, I would like to tell you a little bit more about the tools that we're using in the office to help people to get their health back and to be the best them that they can be. So I would like to introduce you, or some of you maybe you might have been exposed to it, but you don't quite understand how that works, to laser therapy. So there's a lot of different types of lasers. There's different class of lasers. I don't want to make this too complicated today. Many of the lasers, they have FDA clearance. They have research behind it that they've done, research project for different topics of like people having plantar fascia or people having chronic pain or carpal tunnel. And different lasers will do different things in the body. There's some lasers that are more geared towards skin problem. There's lasers that are more for inflammation and pain. There's lasers that are there that more to improve function in the body. There's also lasers that will improve your blood flow. So every single cells, the basis of laser is every single cells have this thing called photoreceptors. And what that means is they are impacted by light. So light therapy has been around for a long time, if you look that up a little bit. But there's a lot of research about lasers, and very few people know how laser works and how you can benefit from laser. But there's great benefit, and we've been using lasers in our office for I would say 15 plus years. And some of you already know that, but maybe some of you don't know. So I want to tell you a little bit about a couple lasers today that we're using in our office. This one here, this is called a low-level laser, a PL5. That's an cornea laser. And it has a specific wavelength, which is 635 nanometers, right? So in the world of lasers, there's specific wavelength and specific frequencies. So this is a 635 nanometers, which is considered to be a low-level laser therapy. There's also another one right here. This is called a derma laser. And a derma laser has 405 nanometers of wavelength. Again, this is more for skin problem. This particular laser also has another wavelength, which is 635, just like the other one, which is, interestingly enough, it has dual purpose, right? So you can have an effect on skin. You can have also an effect. There's also some research that supports from a microbe issues when you're using 405 nanometers. If a person has things like fungus or yeast, that you can just, the body will benefit from this type of light. We also have this big guy right here. This is called a high power laser. This particular one is a 60 watt laser. And the wavelength, right, 810 nanometers and 980 nanometers, which is it's a class 4 laser. So again, there's different classes of lasers, different FDA clearance, different research behind them. What those are mainly known for, right, is to improve inflammation, to go after pain, to improve microcirculation. Those are some of the big things that this particular laser, when you put this lasers on people, if you've ever had it, you're gonna feel the heat from the laser as soon as you put it on, and it goes deep into the tissue. With the low-level laser therapy, also known as cold laser, when you use those lasers, you're not really gonna feel any kind of heat or anything like that. So that's a little bit, they work differently in the body. They have a different effect on the nervous system and on the tissue. So I just thought I'd kind of bring this up to you today and say, hey, why do you choose to do this one laser therapy versus this one? And what's the difference? So in our office, we use it for people that have chronic issues, people that have acute issues. We also use it for scar. We also use it for skin issues for some people when they do have that. On the nutritional side, we also use that as well. So hopefully this was helpful for you to understand a little bit about laser therapy and what they do and how they can benefit a person's body. And as we go through different program and niches that we have in our office, we use that as a tool to speed up the healing process. And what I like to say is to get people out of the ditch faster, so we can get your health back. So hopefully this was helpful. Take care.